Well, did you know that the causes of your craniofacial pain and exhaustion could be TMJ, dysfunction, and sleep apnea? Well, if you believe you're suffering from those disorders, then Dr. Terry Bennett at the Tulsa TMJ Craniofacial Pain and Sleep Disorders Clinic could really improve your life. We welcome Dr. Terry Bennett this morning. And Dr. Bennett, you have a great list of qualifications, including you're the only dentist in Eastern Oklahoma that is board certified in pain management and dental sleep medicine. Plus, you're the president of the American Academy of Craniofacial Pain. Those are some big qualifications here.
Well, it's taken a long time to get here, but yes, thank you so much.
And something we were just talking about on the side here a moment ago, TMJ is a focus that dentists usually don't want to touch, and also physicians kind of steer away from it as well, but it's something that you really like to focus on.
Well, it is. You're taking the medical aspects and applying it to a dental patient, and a lot of times these patients have been misdiagnosed with their various symptoms, and they kind of get pushed through the medical society treating symptoms instead of treating the orthopedic problem.
All right, we've got to talk real fast. What is craniofacial pain?
Well, craniofacial pain is an all-encompassing term that includes anything that includes head, neck, and facial pain, any disorders, any problems of those areas.
All right, and also TMJ dysfunction. How many people suffer from this? They're a pretty long list.
It's a long list. There's about 1 out of every 10 people who have some type of craniofacial pain or TMJ dysfunction. Yes.
And a lot of, you were just saying it's misdiagnosed
frequently because a lot of these symptoms are headaches, neck aches for people, temporal headaches, which are diagnosed as tension headaches, and then unfortunately a lot of patients get introduced or given Prozac or one of the antidepressant drugs. Some of the headaches are migraine type headaches and sinus type headaches also.
You were telling me a lot of your patients get to you and they've been through the ringer seeing doctor after doctor, just treating the symptoms but not the actual issue.
That's correct. Yeah, this is an orthopedic issue in there, and unless you treat the orthopedic problem, the problem never gets taken care of. Symptoms can be helped sometimes, but the problem never gets taken care of.
Another thing you guys really deal with is sleep apnea, and you said there are a ton of Americans that really suffer with this. What are some of the symptoms of that?
Well, sleep apnea, of course, is a cessation of breathing. That's the definition of sleep apnea, but some of the symptoms are loud snoring, excessive daytime sleepiness, falling asleep while you're driving possibly, or reading a book, watching TV, watching a movie, hoarseness in the morning, dry mouth in the morning.
All right, and you said a lot of people are on a machine, but you actually use a different kind of treatment.
The CPAP machine is the gold standard, and there's, unfortunately, again, depending on the studies that you read, anywhere from 30 to 70% of the people on CPAPs who don't use their CPAP sufficiently like they should, or use it all night, or they're allergic to the materials, or the hoses bother them, or the noise bothers them. So we use an intraoral device that mechanically positions the jaw the lower jaw in relationship to the upper jaw, holding it forward, bringing the tongue forward, which then helps increase the airway.
Real quick, obviously you've named a lot of things that you guys do differently, and you love TMJ patients. So those are some of the things that really make you stand out in a unique practice here in Tulsa.
That's correct, yeah. And I think our credentialing makes us stand out too. We've gotten the credentialing diplomates in all these disciplines, which sets us aside, means we've gotten into the education, we've taken the X number of hours that needed, the patients treated, we've defended these cases to a board, and we've also taken a very stringent written exam.
Great. Well, thank you so much for all your hard work, and we want to tell people how they can get out of pain and come see you, Dr. Bennett. Thank you again for joining us this morning. It is the Tulsa TMJ Clinic, and craniofacial pain and sleep disorders is what they focus on. Dr. Terry Bennett, D.M.D. They're there at 1616 South Denver Avenue, 918-582-8651. You can also look them up online. That's tmjuk.com.